Dan, today we're talking about pain, pain management, and the combination of pain treatment through ketamine infusions and ketamine-assisted therapy, the therapeutic component that involves mental health. Will you define pain?
Very dryly, pain is defined as any unpleasant sensory or emotional experience. And chronic pain, chronic refers to the time frame, the duration of the pain. By definition, chronic pain is pain that's lasted for at least 6 months or longer.
The chronic aspect of it is that even after the event, the injury that caused the pain, even after it heals, the brain can send nerve pain signals for weeks, months, and years afterwards. Is that correct?
Yes, absolutely. You even have people that can have remembered pain, even if an injury or insult is gone and is long healed, they can still experience the pain mentally, basically. And of course, with chronic pain patients, there's a very high incidence of depression and other psychological aspects.
Some of the causes of this, other than traumatic injury like an accident, what are the other causes of chronic pain?
Pain can also be caused from nerve damage, which can happen not necessarily from an injury, but from other health issues like diabetes, or even just from aging. Our bodies age, every part of us ages, including the nerves. Patients can get neuropathy, peripheral neuropathy, just as their nerves age over time, even without any specific injury or insult to them.
And at LA Health and Wellness, we treat chronic pain. Patients with chronic pain, and we have a modality that we call ketamine-assisted therapy. We're providing infusions, and maybe you could talk about that just for a moment, the ketamine infusion itself and what that does.
Ketamine is an anesthetic agent, and ketamine has really an incredible role in treating chronic pain patients. And the theory of that is really a few different things. Ketamine seems to have an effect on certain neurotransmitters in our brain that are related to pain signals. There seems to be a de-amplification effect of pain with some of these effects of ketamine on these pain receptors. And in addition, it's been shown that ketamine can have effect on inflammatory mediators, basically chemicals that our body respond as a result of injury to tissues in our body. There's certain chemicals, leukotrienes, these different substances that will accumulate if you hurt yourself, if there's an injury. And the ketamine seems to have an effect on limiting the release of these chemicals. There also seems to be an effect on the pain receptors in our brain. All pain signals, no matter where it is, in our knees, our low back, our toes, everything is processed by these pain receptors in our brain. And the ketamine seems to have a dampening effect on the impulses that are released from these pain receptors.